All right, Matt. So how do you all feel about potentially relieving student loan debt for essential workers? It's a bill that's getting tons of attention right now. So text us your thoughts at 602-444-1212. It's being introduced right now by Democratic Representative from New York, Carolyn Maloney. It's called the Student Loan Forgiveness for Frontline Healthcare Workers Act. And it would wipe out any federal or private loan obtained to receive training for healthcare workers who are working on the front lines of this pandemic. Now, in the bill, the language says that there would be a commission to decide who exactly is eligible for debt relief. But the language is also pretty broad, specifically naming doctors, nurses, and even interns. They would all have the ability to get out from under their debt. And Maloney recently told reporters that her bill would have no financial cap. Now, there are a few other bills out there right now offering relief from debt for all essential workers, not just medical professionals. Some of those bills do have a cap, some of them don't. So we're asking, because significant time will be devoted to it on Capitol Hill this year, how do you feel about dissolving student debt for essential workers? And the comments have been rolling in so far on this controversial subject this morning on Facebook. What about essential workers getting extra money and just bringing the interest rates to zero on these loans? Unemployment is paying people $600 a week, and that's some more than essential workers make in a week, Sarah says. Anthony says, yeah, forgive it. He wants it to all be forgiven. And Steve says, sure, take on all the debt you can get. It's the American way. So, Rachel, the one thing that seems a little fishy to me, and I'm a little worried about, and it was the same thing that happened when they tried to push the CARES Act through on both sides of the aisle. Why wait until there's a global pandemic and National Nurses Week to try and pull at the heartstrings of the Americans and introduce legislation that clearly is something you've been trying to do for years, and there's just not enough support on the other side of the aisle for it? Relieving student debt is something that has been tried many, many times before, and now if we come out and I'm going to say I don't agree with it, I'm going to be looked at as someone who doesn't support our nurses and doctors, and that's ridiculous. I love our nurses and doctors, but at the same time, I see this as being a political play more so than actually helping out.
But you know, Ryan, as we've seen on Capitol Hill, timing can be everything. And I think for some of these legislators, maybe this is their thinking is the time to kind of tip folks over the edge who are on the bubble and not really sure which way to go on this one. There's no question that it's needed. It's ridiculous, the amount of debt that nurses and doctors incur while they're training to treat us. And it's not like it's taking them 2 decades at times to pay off this debt that they incur. Right now, we're trying to fast track a lot of nursing students and doctors to try to get them to graduate so they can be out in the workforce helping us. So it would be nice if they could get some relief, but it's nothing new.